Hello and welcome to Network Insights from Move Consulting. My name is Craig, I'm one of the directors here at Move and a co-host of the Network Insights series. Now, Network Insights is your opportunity to listen in to some of the amazing conversations we're having with the world's leading physical activity, health and well-being experts from across the sector. Today's conversation is going to focus in on taking a pragmatic approach to physical activity research. So, without further ado, I'll hand over to Elaine to get us started.
Hello everyone, thank you for joining us. It is a great delight to introduce today Dr. Paul Kelly. Now I've got to read your title because it's quite a long title. He's a lecturer in physical activity and health based at the Physical Activity for Health Research Centre, and you're probably the person that lives closest to where I do of all the people we've spoken to, because you're only down or up the road from me, so that's good. So welcome, Paul.
Thanks for having me.
To have you. Can I kick off? Looking at your CV and your career, you've done a whole host and range of different projects involved in different types of research. Can you tell us a little bit about, for our listeners, a little bit about your background and your interests and where you've been based?
Sure. Absolutely. Thanks, Elaine, and thanks, Craig, for inviting me to speak to you today. So, like many people in our field of physical activity and health research, I came from a sports physiology standpoint initially. I was sure that I wanted to be a performance coach or physiologist on some sort of Olympic team somewhere, and was happily studying that at master's level. And towards the end of that degree program, we had a lecturer, you may have heard of, Charlie Foster, and he gave the lecture on kind of, what would it have been called, sport and population health or something. And his opening line was, you've spent all of your program looking at how you can help one person be a fraction of a percent better. How about we think about how sport, and he did say sport, how sport could help millions. And I thought, well, that's interesting. And then, of course, over the course of the lecture, he, sort of opened it up from just sport to exercise and then walking and cycling and physical activity in general. And really, that was the turning point for me away from physiology, performance physiology, to physical activity and health research. Charlie became my PhD supervisor, which I did looking, we were using wearable cameras back in the kind of around about 2007, 2008, and that was kind of really interesting about how that got me interested in how do we measure behavior, how do we understand what someone does, how do we know if our intervention worked, did behavior change, or these sort of questions. And I ended up staying at the group there, the British Heart Foundation group. I know that was closely related to your group as well, Elaine, for nearly 10 years. But then I came up to University of Edinburgh to work as a lecturer in physical activity for health. That was in Nanette Moutry's group. She just founded it a couple of years earlier, the Park group you mentioned, and I've sort of happily been here ever since, trying to working with students from first year undergrad through to PhD on how we can train and upskill them in physical activity promotion, and then also as part of my job trying to do some research as well.
So, Paul, you mentioned PARC. Tell us more about that. So that's an acronym. It's not the word park. So tell us more. What does that acronym stand for? What does PARC do? Elaine mentioned in the intro, based up at Edinburgh, but
yep.
Yeah, paint that picture a bit more vividly for us.
PARC, PAHRC, Physical Activity for Health Research Centre. So we're a group of like-minded researchers who are basically in different ways trying to do research that helps us promote, maintain and support physical activity across the population. Sometimes that might be focused very local area, in and around Edinburgh where we're based, but also, trying to do research that's relevant internationally with, colleagues and populations across the world. We're I think we're normally about between 6 and 8 kind of full-time members of staff, and then maybe same again with research assistants and PhD students as well. So that's the brief history of Park. We most of us, if not all of us, have dogs, so we sometimes joke we should be called Bark, not Park. We're sticking with Park for now.
Does dog ownership just get you straight in? I'll join.
It doesn't seem to hurt. It doesn't seem to hurt. Certainly when we talk about our favourite activities, dog walking is often near the top.
Yeah, absolutely.
Well, what I really love about that group is the pragmatism and the fact that you are really grounded in research that is going to impact on policy and practice in the field, which isn't, if we're honest, doesn't always happen across all universities. And that's the one thing that I think when it was set up, it really struck me that this is about how do we do things better? How do we impact on the population activity levels? And I really admire the work that goes on there, because that seems to be at the focus of everything. So yeah, it's great. It's really good. And I'm lucky enough to get along to listen to some of the lectures sometimes. So that's even better for me. So yeah, thank you.
You mentioned Charlie as your PhD supervisor. Charlie was our first guest on Network Insights, and we explored in that the hidden guidelines of physical activity, and we spoke about the importance of strength within those guidelines and how that had been an element that was overlooked. And he did mention, actually, I think it was Fiona Bull, he was quoting a conversation or paraphrasing a conversation with her about the development of the perfect guideline. And it was around, what is the ideal guideline? Is it the one that's completely belt and braces evidence based and you can't argue with it, or is it the one that actually changes behavior or policy or whatever it would be? And you can make your own mind up as to which one you would prefer. I know I would lean certainly one way to the other rather than sitting in the middle of that, but it's interesting that there is that connection, and in relation to the work that you are doing and the point Elaine's just made, that pragmatism in the way that we take on research or think about it in what we're doing. Here's an area I'd be interested to get your views on. It's often seen as research is this big, clunky, nervous thing to approach, and it has to be done in a particular way, otherwise you get it wrong and things like that. Like, when we talk about taking a pragmatic approach, what do we actually mean? Let's break that down, I guess.
That's a good question, Craig. So there's I don't know if this name has come up in your conversation so far, but another kind of eminent name in our field is Harry Rutter, Professor Harry Rutter. And I don't know, his focus is more on obesity prevention and these things, but something that he has said often and sticks with me is, don't let perfect be the enemy of the good. And we could interpret that, I guess, in a number of different ways, but for me what it means is it's better to do something that's good than to do nothing, because we were arguing how to make it perfect while the world was going on around us. So maybe something to do with diminishing returns. If we can do something good next week, is that better than spending another year to make it 5% better before we start? And especially when we're talking about something around public health, health promotion, physical activity, the longer we do nothing, the more potential harm or burden is experienced by the people who are waiting for us to figure out how to do perfect physical activity promotion or come up with the perfect guideline or whatever it may be. So, this notion of, is it better to do nothing, or is it better to do something with the information we have? And for me, pragmatism is trying to get your head around those questions, and when it's appropriate to try and do something that we think is good enough, versus knowing when it's better to hold off and take a little bit longer to prepare.
I've come across that in a practice sense as well, where somebody once sort of had a conversation with a head of leisure services, which went along the line, there is no evidence for leisure services, so why should we be funding it? And it was kind of like, Well, that's fine and dandy, but what else are you going to do instead? Because that money will just get sucked away and disappear into a big black hole if that had ever happened, and they didn't have a solution for that. So it was kind of it's this balancing act in policy all the time, isn't it? In terms of what we know works, what we've got to just suck it and see and try it and make it work over time and learn as we go along. It's a real challenge. Yeah. You've done lots of research, though, going, in terms of the work that the centre does and you've done personally. And it would be really nice to hear about some examples of that research and how and what sort of things you've been involved in.
Sure. So a big project that's coming to an end now and is quite a nice example because it was a number of colleagues from Park and more broadly as well, was our evaluation of the 20-mile-an-hour schemes in Edinburgh and Belfast. And I think that's a really good illustration of when we had to be pragmatic, because there was no possibility of doing a RCT, randomized controlled trial, of 20 mile an hour on some streets and not others, not least because that wouldn't make sense from a coherent transport policy point of view. People keep changing speed between one and the other, so we had to take a much more flexible approach to how do we generate good enough evidence on the impact of these schemes. And added to that, they'd already been in place for about a couple of years by the time the funding came through and the project got underway, so we didn't even necessarily have a reliable baseline. As you might naturally expect in something where you had more control over the research design. So it was very much how can we take this natural experiment opportunity and generate useful evidence on what happens when you deliver 20-mile-an-hour schemes, how do you deliver 20-mile-an-hour schemes, what was learned in the two places, what were the similarities, what were the differences, what were the political processes that meant that in these two cities it took place, but other places in the UK, it maybe they either started and then it was stopped, or it never got off the ground in the first place. And what that involved was, bringing together a team with a lot of different specialities, be that quantitative statistical analysis to look at some of the traffic count data and traffic speed data, or qualitative skills, to do meaningful focus groups and interviews with local residents, local stakeholders, bus drivers, shop owners, these sort of things. And then, of course, like I say, people who have a experience in looking at political processes and documentary analysis and all these things. So I like the 20-mile-an-hour. It was a program of research that illustrated, lots of different methods, approaches, and then, we had to bring it all together to come up with some sort of, a 400-page report isn't much use to anyone. It isn't particularly pragmatic. So we then had to figure out how to synthesize it into meaningful, useful, but rigorous and defendable findings at the end of the day. So yeah, that's probably the one of the ones that we spent a lot of energy and time recently, and has just come to an end at Park as well.
And it's interesting in terms of that research piece. You might hear that and think, well, how does that connect in with physical activity in relation to it? But there's often almost a bit of a standardized approach or a general approach to how you might think about this. And for me, it'd be stage one is to explore the benefits and the meaning of those benefits for the people in which a change may come about. So make it important for them and make it resonate so it feels important to them as well. And then from there, it's a case of we'll empower those individuals, whether it be a group or an organisation or even an individual person, with the appropriate skills. And we subscribe to a behavioural change model, the COM-B model, which you'll be very aware of. We think that's a brilliant platform to just help segment your thinking, really, in relation to, am I covering a number of different areas? So that connection between where research actually makes a difference, I think learning it came to mind before. I was going to jump in when Elaine mentioned it, where if you replaced research with it's essentially learning something about what's going on, So what did you learn as a result in relation to physical activity benefits, potential benefits, I should say, around 20-mile-an-hour speed limits? Were there any learnings in relation to changes that led to physical activity, or is there anything in there? If there's not, no is a perfectly good answer. But
we learned some interesting things. So, of course, one of the reasons that as physical activity researchers we were interested in 20-mile-an-hour schemes was because we know that the physical environment and perceptions of risk and perceptions of safety are big predictors of whether people do things like walking and cycling, whether they feel safe in their environment, whether they feel safe for their children to walk or cycle to school. Older people, especially, it's a really big predictor of whether they stay mobile, keep using their local community. Does that mean they stay socially connected? So there's, multiple pathways by which this could potentially be impacting mechanisms of better health. What did we find? Well, we found that people did feel safer. They felt that there was less perception of risk. They felt that the environment was more what we call walkable, more conducive to walking and being cycle friendly. That was about a year later. So these weren't kind of transient, they felt better for a week and then it went back to normal. These were lasting effects. It hadn't yet translated into a change in behavior in walking or cycling. But as I said, that was more, I think, our inability to detect any change in behavior, because that's a really difficult thing to do at a city level. We could have cycle counters or indeed people doing census of walking numbers, but then saying that was down specifically to the 20-mile-an-hour scheme and not a result of the 20 other things that were going on in Edinburgh at any given time, from roadworks to cycling schemes at school to the weather, is a kind of very tricky task. So this notion of attribution when you're doing these natural experiments at a city level is much more challenging than, like I say, if you're doing a tightly controlled laboratory experiment. So I think that was one of our key learnings as well, was around the difficulty of saying that we can detect a change in behavior, and actually having to be maybe more comfortable to say that we can detect strong changes in known predictors, we can detect strong changes in known variables, and then are we comfortable with the assumption that would lead to the behaviors and the health outcomes that other evidence would support.
And again, it's a common theme for those that have watched a multiple of the Network Insights series. We talk about there being no silver bullets, and in relation to research, back to that challenge of pragmatism versus kind of realism, if you will, in relation to the physical activity guidelines. Charlie's example before, the research and the completion of research won't magically mean that something happens differently. You've just learned something new. So then, like you said before, now with the new information, what do we now know? And the outcome of that research might be we need to do more research, which is, if I'm being flippant, it's normally the last bullet point on most reports, isn't it? It's all of the findings and we think you should look into this a little bit more. But that said, there's genuine elements in that, because you do learn new things. Sometimes the outcomes, to a degree, almost contradict what the initial projected outcomes for the project might be, because you've learned so much from it. And that connection about making it real, that connection from the research, using that COM-B as an example, which is what I was alluding to, I guess, is the work, therefore, that you then need to do beyond it. Because 20-mile-an-hour speed limits, perceived safer environment, right? We've now got a new playground to play in, if you will. What do we now need to do to raise the capability, opportunity, motivation for people to activate that space, or to take a different change in their behavior, I guess. So it's really interesting, that one. I saw on LinkedIn this morning, Liverpool have got behind the car free day. That's another element behind this, but that's a completely different outcome. It's still based around vehicles, but a different area an approach taken, much more connected to, I guess, environmental benefits, but equally, could a car-free day be then a kick-off into slower speeds in certain zones, residential areas and things around there? So what about any other bits of research that you've done? I know that we've tried to work together on a couple of occasions on projects to get things off the ground in terms of kicking off that connection from research into physical activity and design of interventions. Are there any other key bits that you'd raise that you think might be of interest?
I mean, I suppose there's always a kind of production line of research at any one time. The work that we're spending a lot of time on at the moment is around messaging and communication, and that's with my colleagues at Park, Dr. Graham Baker, Dr. Chloe Williamson, and others. And what we're looking at there, in many ways, builds from the guideline work that you may have discussed with Charlie, because it was our view that when the guidelines were updated in 2019, there needed to be consideration about what was going to be communicated to the public. We didn't think it should be 150 minutes of moderate to vigorous physical activity or 75 minutes of vigorous activity or some combination thereof. That's just about the worst message I think you could give to the population. You know, what is moderate to vigorous physical activity? Who thinks in terms of 150 minutes a week? You know, like how much did that sandwich cost? 150 pence. Like, no one thinks like that. You know, we think in terms of 30 minutes a day or 2.5 hours a week or something else. So that was kind of really much, very much a stimulus for us to think about how can we do better messaging in physical activity? How can we generate better evidence that can then be useful to practitioners and professionals working in that space? We found that what seems to be missing often and is really important is initially stating the aim of the message. So are you trying to A, make people more motivated, B, give them knowledge of the benefits, C, set them targets that they should try and hit, or something else? Because if you don't have that statement of aim, you can end up with a very muddled message that it's not clear what it's trying to do. So by stating the aim, you can then think about, you know, actually, if what I need to do is increase awareness of local opportunities, that makes it much easier then to come up with some content that will achieve that aim. And then finally thinking about, well, how am I going to deliver it? Should that message be delivered on the radio, on social media, you know, in the print media? And of course, whoever your target audience is will help answer that question. So we've really enjoyed that research, and it's had a lot of pickup from, we're starting to work now in partnership with a lot of kind of charities, third sector, policy and healthcare professionals. Because it gives them a framework, and I think they find it really usable and useful, and it's great for us to see the research going into practice in that way. So that might be the first example of work, and then another project that is coming to an end is work we did locally in the Forth Valley Royal Hospital, where patients who were diagnosed with colon cancer, bowel cancer, were referred to get an electric bicycle from Forth Environment Link, a sustainability charity in Falkirk. And what they wanted, the notion was that by using these bikes, they could get fitter before surgery, prehabilitation, and then fitter after surgery, rehabilitation, as a way that was felt might really reduce complications and improve their outcomes. And there were some fantastic results from that. It was a feasibility proof of concept study, but the impact it had on the patient's mental health when they used it was astonishing in terms of how it connected them with nature, how it got them away from negative thoughts, how it gave them something proactive to do. So really all the things they spoke about weren't necessarily the surgical outcomes that the clinical team were interested in, but were really motivating factors for them. Not everyone took it up, and not everyone was, you know, there was a sort of frailty screening to make sure that it was safe to ask people to use the bikes. But we've learned a lot there, and we're trying to feed that learning back into phase 2 of the project now, which is kicking off shortly. So there's, you know, I don't know if I spoke for too long there, Craig, but there's 2 examples of the sort of work we've been doing recently.
No, that's brilliant.
Those those examples both resonated with me in two different ways. One was the messaging project. I remember when we did the review of the CMO guidelines in 2010, I think I chaired a wee meeting, a side meeting early one morning to discuss how were we going to market this, and then we were told there was no money for it, so that kind of went out the window. And the second one is we had a previous conversation with Nick Cavell around the use of electric bikes, and I think it is really interesting because personally I cycled up and down to my radiotherapy appointment when I went through breast cancer treatment. But I had somebody referred to it as my Miss Daisy bicycle. It's like, it is the heaviest. I mean, it's never going to break. It's a solid Dutch bicycle, but the gears are rubbish. And luckily there's only one wee hill that I had to have to cycle up to get to the hospital. But I used to love that cycle back and forth because you were moving from that environment, which was, I felt like I was walking into actually there was one session where a fly got in and I really thought I was going to turn into Jeff Goldblum. So you're in this very, very technological environment, and then I get this lovely cycle back via the River Taff on the way back. So it was, so there is, I can totally relate to both of those on different levels. So yeah.
There are those parts. If we think about that, how research can impact and affect what we do, you've got the kind of credibility and validation of certain initiatives and designs of things, how they operate and how they work. But then there's that more qualitative, and I it's a personal opinion here, but the more impactful from a personal level is the qualitative feedback of how people talk about physical activity. I used to work at British Cycling, so I've got an obvious bias towards cycling as an activity and as a sport. But that said, the world looks very different on two wheels, because if you think about the position you're in, you're higher than a car and you're not surrounded by glass and pillars, and you can feel the breeze and all things like that. So the environment that you're in does look very different. If you're on a busy road, it might be quite intimidating and scary. So maybe there's a merger of all these different bits of research and projects that we've had where we need to overlay them to create the perfect environment. But the individual experience is one thing. It's then how that person goes away and conveys that message to their friends, because the influencing piece is really, really key here. And I like the idea that there is a framework for messaging for potentially organizations or healthcare professionals. And we often talk about educating people of the benefits of physical activity, but those skills of talking about it and sharing what those benefits are, peer support, we hear so much about. I'd be interested to see if there's any bits of research available around the impacts of those. So how far does that message get? My mind comes back to, from a healthcare professional perspective, I think it's 3 times more likely to act on advice given from a healthcare professional because of that white coat perceived authority. But how far does it go from a peer, from Elaine as my friend and colleague telling me that this is a good idea to go swimming in the sea and freezing myself half to death? I wonder.
You need to give it a go.
Yeah, it's just it's an off the cuff thing to share, Paul. But is there anything in relation to that kind of the network of how far those positive messages go before they fall down that you're aware of? Again, no's a perfectly good answer, but
I don't know. I was sort of thinking as you were talking, Craig, when you're saying there about educating people of the benefits, and I think that was one of our motivations, is that there's plenty of people who know the benefits who don't act on that information. So it might be that if you can come to learn that, you might then say, well, the aim of our message is to motivate people more. And if you think of, for example, the This Girl Can campaign that Sport England ran, there was nothing about benefits in there. It was about making it look fun. It was about making it look accessible to people of different shapes and sizes and abilities and ages and backgrounds. And it was, combining it with cool music from Missy Elliott, I think, initially. So I think they've really figured out that if you want to motivate people, don't just hammer them with a list of diseases that, to scare them, but actually sell it as something that's fun, motivational, and people like me are doing it. So I think there is some really great messaging out there, and I suppose what our research was trying to do was just capture, what's the good stuff and how can we, disseminate that, more widely.
Yeah, absolutely. Well, I guess in relation to the focus of all of our Network Insights episodes, what we really want to try and come to, and you've shared some examples already, are some considerations or potentially things that people can take away and act on in relation to if they are, let's say, commissioning or designing or managing a physical activity program in some way, shape or form. So are there any golden nuggets that you would want to either re-emphasize from what we've shared already or share again to get the ball rolling? One thing that we'll definitely do is Chloe's work in relation to the framework. We can make sure links for that are shared below this video, so go and take a look at that one. That's a thing for people to definitely go away and have a think about. But any golden nuggets, considerations for others to think?
I suppose this notion that being comfortable with a pragmatic approach, knowing when it helps, but also knowing when not to. There are times to halt and take a bit more time. So yeah, getting comfortable with that set of decisions. Thinking about having a clear understanding of what the aim of the research is and how you're going to use it. So knowledge for knowledge's sake has a time and a place, but I think in relation to your question, Craig, it's about having a clear plan for what do we want to know, who's it for, and how they're supposed to use it. And I find that working for those questions helps make the decision between should we be doing qualitative, should we be doing quantitative, should we be doing a mix of the two approaches. And I think that might be it. That without overstating it, I think I try and use that thought process when I'm planning, doing reporting research, and it helps me not get sort of stuck in the weeds and tangled up in my own thoughts. So maybe there's something in there for your audience as well.
Yeah, I think that is really interesting what you're saying, because I was thinking back to the two extreme examples that I can think of. So the randomized controlled trial that was involved in for exercise referral, we were making a case to policymakers, to public health, to health practitioners, and that was what they wanted and needed to be reassured of its effectiveness. But then I remember we did a series of workshops around evaluation with Nick Cavell was one of them, and Rob from Sheffield as well, and it was a lot of it was when we asked practitioners, who are you trying to convince of this? It was like counsellors, and so where we ended up back at was, well, case studies and pulling at heartstrings and really understanding it from that perspective, and understanding your learning is critical to that. So that knowing who your audience is absolutely core to all of this. So yeah, totally agree.
Yeah, and that same principle cascades all the way down that pathway, doesn't it? Because at an individual level, if you're trying to engage an individual in a physical activity program, or they're even there and you're trying to get them engaged in the session you're delivering, understanding their needs and tailoring your messaging to them. An idea or an example's popped up in mind of when I used to, now I think is the right term to use, coach running groups. And in terms of, I would deliver one running session to people with a whole range of motivations for being involved. Yet the one session I would deliver, I wouldn't necessarily tailor the activity to meet their needs. I would tailor the way that I talk about the activity and how they can use it to meet their own needs, because I have personally a very much empowerment philosophy within my coaching practice. So I don't know, we're doing a fartlek session which is running at different speeds. So to the marathon runner, this is how this can help you use it in the way that you might. To the absolute beginner runner, we're just going to try and make sure that we can change speeds at different points and not be too out of breath. So back to that messaging, that's as relevant, that principle, at a granular level as it would be at a broader level, I guess. And the bit that stands out to me the most about what you shared, Paul, is keep it simple. You came out with 1 point, that'll do. And it's like you said before, with regards to the research, I now know one new thing. After I've applied that and thought about it, what's the next thing I think I need to think about and learn? So that's really quite profound, I guess, is one way of putting it, which is good. It feels like we've come to a bit of a natural end in the conversation there. So in relation to the call today, thank you for taking the time to share your insights, Paul. There is loads, as short and sweet and to the point as this conversation has been. It goes without saying there is loads of information available via the university and the centre. So Park Physical Activity for Health Research Centre at Edinburgh University. We'll put links, as mentioned, in the feed below this episode. So thank you again for your time. We will call it there. For those that are watching, if you are new to the series, please do visit the Move Consulting website, moveconsulting.co.uk/network-insights to find this episode and others in the series. But apart from that, we will see you next month. Thanks again for watching.